Hey good people, this is Dr. Otey of Dayspring Life and Health channel, where we give you information about how to improve your life in terms of your health as well as your soul. Today we're going to hit on treating constipation with medications, over-the-counter medications as well as medications that require prescription. And don't forget to hit that subscribe button. I would greatly appreciate it if you subscribe. The natural ways to prevent constipation, just before we discuss the topic treating or how to treat constipation with medications. Exercising or increasing your physical activity, drink lots of fluids to ensure that you are not dehydrated. Starchy foods, oily or fatty foods and stuff like that, you should avoid in order that you can have an easy passage of stuff down the tube to avoid constipation. We also said that avoiding foods that are processed would also help. If we balance our diet with foods rich in fiber, we are going to help reduce constipation. So sources of fiber include vegetables, whole grain breads would also help because they have a lot of fiber. Cereals that have high content of fiber. Some people also use bran, but bran can also make you gassy. You can also use probiotics. Probiotics are usually suggested or recommended for people with chronic constipation, just as a preventative, and it also helps to make you regular. If that doesn't work, we have over-the-counter laxatives or medications that are sold to help you with constipation. And we will start, I'll just call the big names and then I'll reduce them down to what they are. And I'll also show you pictures of some of them. So let's start with the bulking agents. Bulking agents are basically your fibers that have been made into over-the-counter medications that you can take. Metamucil, which is the brand name for psyllium. Metamucil is on the shelf in almost every grocery or pharmacy shop. There's also one called methylcellulose, which is the brand Citrusel, which is also over the counter that you can purchase. Now, both of these have been made into either fiber chews or powders or capsules that you could buy and use depending on which one is most convenient for you or which one you find easy to take. So the Metamucil packets, the Metamucil cookies, like same for Citrusel. They have them in capsules and they have them as fiber that you can just buy and drink. The only caveat to these fiber supplements is that you have to make sure you drink lots of fluids with them. You have to drink lots of fluid with them because the way they work is like the name suggests, they bulk and they need water to bulk up. You need to have water, enough water when you eat them or when you take them, so that they will hold water and pick up other stuff in the colon. The other ones are the osmotic agents, and those work by drawing water into the lumen by osmosis to soften the stool. And examples of those are Miralax or polyethylene glycol, and the sugars, which include lactulose and sorbitol, and then the salt or saline laxatives, which are your milk of magnesia, magnesium citrate, clear liquids that people usually buy. Some people are told to drink it before surgery and stuff like that. The thing with these two or these osmotic agents though is that if you have any kidney problems, then you should be careful how much you use, because they could worsen your kidney problems just because some of the salts get absorbed. The other product that we can also talk about is the stimulant laxatives. And as the name implies, these ones actually stimulate your colon to move. They stimulate your intestine, your large intestine, and they cause movement, and since they are forcing it to move, they will cause stuff that are sluggish there to start moving and coming out. The examples of those are the senna, or maybe in your store shelf they may call it the senna cut. Also, I think there's another one called bisacodyl, or in your store the brand name would be Dulcolax or bisacodyl. And again, your store brand is just as good. Take these by mouth like tablets, but they also have formulations for suppository. These ones work right away. Within the suppositories, within 15 to 60 minutes, 15 minutes to an hour. But if you took it by mouth, it would take a little longer than that. So that is how those work. These can be used for not too extended periods of times. It's advisable to use them only up to some point, and then you stop and let your body kick in and start doing the job by itself. But if your situation is so hard that you are unable to go regularly even after going the first few times, then you may be able to use it once or twice a week, or maybe every 3 days, working with your healthcare provider. The ideal is you use them when you need them and you slowly stop. That way your body will itself kick in and take over the natural ability of moving stuff down by itself. So make sure you also drink lots of fluids with these, because these don't have anything in them to replenish the water you lose as a result of pooping a lot. I also want to make you aware that there are enemas. We have enema that you could also use. The enemas are also quick onset, because you are going just like the suppository. You are going right in the back, right from the bottom up. As a matter of fact, you could use water as an enema. If you have a tube that has a safe edge, safe tip that you could use, for an enema, you could put some warm water with the temperature the same as your body, 98 degrees Fahrenheit or 37 degrees centigrade, warm water, and you can go behind through the butt and use it as an enema, and it will get your stuff out. But that is when you are very impacted. Those really work when you are very impacted. That is, the stool is so hard that even when you take something by mouth, it's not able to push it down. From the initial ones that have to come out are stuck. So you use an enema, whether it's a water enema, or if you buy on the shelf, there's an over-the-counter preparation called a fleet enema. Those have also been done mixed with salt and all that. The store brands, again, that are next to them, so that will help you, and that will let you go right away. After you use it a few minutes, you should go to the bathroom. If it is so hard that you can't get them out, then obviously you have to see your doctor, for the doctor to basically use they will have to go through your butt with a glove and remove the hardened stool. Stool softeners, sometimes you will need to take a lot. You could take up to 8 capsules of the 100 milligram stool softener called Docusate or Docusate sodium, and they are fairly safe, very, very safe. So that's what I'm saying. You can titrate up. You take 2, you don't go, you don't feel anything. Take another 2, you don't go. Obviously, you got to give yourself time, but you still don't go. Take another 2. You can take up to 8 of those capsules to go, and they are pretty safe. The only side effects would be maybe occasional flatulence, passing out gas. Some of them are actually made together with a stimulant. So there is one that is called Senna Plus. So Senna Plus basically has Senna and then Docusate sodium. So it will make the softener will make it soft, and the stimulant, which is the Senna, will push your bowels to go. And if your constipation is caused by medications, then You will have to take those stool softeners, some medications used to treat depression, some medications used to treat hypertension, some medications used to treat seizures. If you are on a seizure medication, some medications may cause constipation. Or if you are being treated for Parkinson's disease, some medications may cause constipation. Iron supplements, some antidepressants may cause constipation. If you take amitriptyline, you could be constipated. You will have to take those stool softeners, but if those don't work and the doctor has to do something with prescriptions, then you may be prescribed something called Movantik, something called Simproic, a newer one called Relistor. Those three are used to treat constipation associated with using strong pain medications. But there are other forms of prescription medications for constipation that are not due to pain medications. So you could use something called Amitiza or Lubiprostone, and then also there's a prescription called Linzess. Linzess is linaclotide. The other one is Motegrity, which is Procalopride. All three can be used in chronic constipation or chronic idiopathic constipation. Basically, any constipation that is not relieved by the over-the-counter medications, you could use these prescription medications to treat. So all three can be used in chronic constipation. Amitiza and Linzess can be used in IBS constipation. So don't forget to subscribe to the channel, and don't forget to comment